Hi, and welcome to King County at your service. I'm Tim O'Leary. Next time you walk into a King County restaurant, you may notice something new, a food safety rating sign in the front window. It's all part of a new program by Public Health Seattle, King County.
In King County, we enjoy a vibrant, multicultural restaurant community.
Food is something that touches all of us. It brings us together, it's communal, it's cultural, and we want to celebrate food and want people to feel confident in it. We also know that if it's not handled correctly, it has the potential to make people very sick.
It's okay to leave them at room temperature.
That's why all the 12,000 plus restaurants in the county are regulated by Public Health Seattle and King County.
If a restaurant is open for business, they have gone through the steps of getting a permit through our office and also meeting the minimum standard for food safety.
And then just remember not to cover them.
Depending on the complexity of the operation, all restaurants are inspected 1 to 3 times a year.
Do you guys ever carry raw shellfish like clams, oysters, mussels? Our role is to promote food safety and to prevent foodborne illness.
You can see these inspection results online anytime at the Public Health website. But now you'll be able to see a more visible rating right in the restaurant window. These emoji are part of a new rating system for restaurant food safety practices. It will be based on a restaurant's last 4 inspections, instead of grading on a single snapshot.
We showed a range of images to people, and we found that the emojis and the smiley faces really were the most universal communicator.
I think it's quickly recognizable, but I think it is universal in some sense. Hopefully a smiley face is, will be forever recognizable.
Because our ultimate goal is that we create something that is universally understood, that we're able to put an image or a message out there and that people are able to understand it, regardless of what language they speak or what their reading level might be.
So how does the new system work?
The minimum smiley, the wording for it is that it needs to improve. And it's a smiley face that essentially has a straight line. And the reason that we made that the lowest starting smiley face is because, again, a business has met the minimum standard. The next level above that are businesses that are doing better than having been closed at some point or needed return inspections, but they've likely had many food safety violations. All of those violations are things we correct on site. So when those happen, we want the public to be assured that we've worked with the business to correct them. The next smiley face represents good. It likely means that a business has had some violations, not a large amount of violations, but not none. They've had some. And then the highest rating a business can get is the biggest smile of them all. It represents an excellent food safety rating. And those are businesses that have likely had no or few violations.
A restaurant is a happy place. People come here to have fun, enjoy the food. So we want to make sure that everybody is on the same side so that everybody can enjoy their time here.
The ratings will be posted on-site and online.
So third-party entities such as Yelp or Urban Spoon could all utilize that data and include it on their sites as well.
This will provide a good kind of baseline for people to just make sure that the places that they like and they frequent are doing, kind of upholding their end of the bargain and keeping their standards high in regards to food safety.
To find out more, visit kingcounty.gov/food safety rating. Like many places around the country, King County is battling a heroin opioid epidemic. In 2016, King County Executive Dow Constantine and Seattle Mayor Ed Murray called for a task force to collaborate on solutions. Here's some of their recommendations.
It's a public health epidemic and it is at crisis levels.
We still have people who are dying every day.
Somebody who overdosed in their car on I-5.
Heroin or an opiate overdose kills someone in King County every 1.5 days, and the number is rising, not just for those on the street, but across all socioeconomic backgrounds.
I can speak personally that my brother died of a drug overdose 12 years ago, and he was a college graduate. He had a good paying, excellent job at a bank. He was doing well for himself. And nobody knew there was an issue until one day we got a phone call from the hospital that he had died.
In 2016, the Heroin Opiate Addiction Task Force was formed to find solutions. Its first recommendation: prevention.
80% of people who newly start heroin started with prescription drugs.
Prescription opioids either prescribed to them or prescribed to someone else, and they were diverted, misused, looked through a medicine cabinet, someone in your family, friends, or buy on the street.
Our prevention recommendations really focus on moving upstream, right? How can we change prescribing practices? How can we change the way conversations are happening at doctor's office? How can we change the way we're looking at opiate use disorder?
Besides educating prescribers, the focus is on safe storage of prescription meds and safe returns or take-back sites for unused pills. Also, more screening for opiate misuse in schools and healthcare settings. There's also a strong focus on treatment.
Treatment is really the foundation of our response, both locally and nationally, to this epidemic. We have treatments that will reduce the risk of death by 50%.
We have to be able to provide treatment to people where they're at, when they need it, in a way in which they'll accept it. Because if my treatment resources say, yes, you can come in and receive treatment. We know you have a heroin issue. You can come in treatment as long as you jump through this hoop, this hoop, this hoop, this hoop, and this hoop. For people who are already having really a hard time living their life on a daily basis, we're not going to be successful. A great example of something that the task force brought together was providing treatment resources in a low barrier way at the needle exchange.
Hi, come on in. You can just drop your used syringes right there in the chute, and we'll give you whatever you brought in. It's a one-for-one exchange.
So we know that people already come to a needle exchange for health services, right? For HIV, STD prevention. Many people who are already intravenous drug users. So if we can say to them right then and there, hey, do you want treatment?
We have social workers here if you want to talk about treatment options. One option we have on site is a Suboxone program called Buprenorphine Pathways, and you can get medication today to help you with your opiate addiction.
Rather than sending them across town, making them put them on a wait list for a treatment slot a week and a half, 3 weeks down the road, we can say, if you sit tight, we can have a doctor see you within 20 minutes.
We have folks who have chaotic lives. There's a lot going on, and with each step it takes to get into treatment, there's an opportunity missed. So we constantly see the more barriers there are to care, the less likely someone is to get the help that they need.
For those who don't get treatment, the goal is preventing overdose. And there have been some successes with an anti-overdose drug called naloxone.
Through King County, we put out over 1,500 Narcan kits. We know from what we're tracking that at least 19 reported overdoses have, there's been a successful use of Narcan to bring somebody back to life. The Metro Police are carrying them, Seattle PD is carrying, many of our suburban cities, their police force is carrying them, EMTs countywide are now carrying them. So we've been really successful at getting naloxone and Narcan out far and wide as possible.
The task force is also recommending supervised injection sites.
Pilot test what we're calling community health engagement locations, which are an extension of our needle exchange services to allow people who are currently using drugs in public spaces to use them indoors under the supervision of a healthcare provider to prevent deaths by overdose, to prevent transmission of infectious diseases, and most importantly, to give them a doorway by which they can access treatment for substance use disorder.
It's not only a public health response, but it's a law enforcement response. We've talked to our law enforcement partners and community partners all over the place that are picking up needles off the street, or trying to work with a family so that when they get off of a bus at a bus stop downtown or anywhere else across the community, they're not coming off of the bus and the first thing they encounter is somebody sitting at a bus stop with a needle in their arm.
We have all the tools we need to solve this problem. What we need now is the will and the resources to do so. This is a major epidemic that again is leading to a decrease in life expectancy in the United States. These deaths and substance use disorder are preventable, and they're also treatable.
If we don't start to get ahead of this curve and start to be able to provide treatment opportunities for those who need it, then we'll never be able to get ahead of this curve. And more families are going to experience the same tragedy that my family experienced, and the same tragedy that so many families across our community have experienced. That phone call from the hospital that said, hey, I'm sorry to inform you, but your brother passed away, it is an experience that I don't ever want anybody else to have.
To find out more, visit kingcounty.gov/heroin task force. Here's an antidote for high-priced housing in our region. There's an affordable housing complex in Federal Way, and it's dedicated to some pretty amazing people. It might look like another high-priced condo complex in a land of unaffordable rents. But these new units are reserved for a special group of people. Veterans, the men and women who've served our country.
Ready? Ready.
We have an older gentleman who literally walked out of the woods, hasn't had a home in 25 years. This will be his first home in quite some time. He's very excited. Then we have a young mother of 3 children who's serving in active reserves but is homeless. This will be her first permanent home in a while, just in time for the holidays.
The William J. Wood Veterans House in Federal Way will house 44 vets and their families. It will also provide wraparound services.
They'll have access to employment assistance, to training on site, to counseling on site. They'll have case managers that work with them to make sure that they're linked to any resource they need to be successful. We'll have some support services. We have a van on site to take them to appointments. And of course, being able to meet with their Puget Sound VA healthcare case manager right here on site without having to go anywhere is a great benefit to them as well.
The $13 million multi-service center is named for Vietnam veteran William Wood, a longtime advocate for veteran services.
Mr. Wood was an advocate for the Veterans and Human Services Levy. We know that he was instrumental in creating a way to help incarcerated veterans get back on their feet, back into the workplace.
He was a great man, great man. He was a helicopter pilot in Vietnam. He flew treetop, and he was shot down 7 times. And survived. It's kind of sad that he isn't here to see this, because he would be so proud. It's everything we've worked for, everything all of us work for that in the veterans community, is to make sure that there is a safe place for veterans and their families to live. And it's permanent. It's not transitional, it's not temporary, it's permanent. And they get to live here for as long as they want.
Looking for a break on the cost of prescription meds? Well, here's one way to save some money.
Looking for ways to save on prescription medications? Well, there's a new option for King County residents, the Live Healthy Prescription Discount Card. Here's how it works. Next time you pick up medications at a participating pharmacy, present the card and receive a discount averaging 24%. It's also good for discounts on medications for your pets. The Live Healthy Discount Card is free. If you don't have health insurance, it will help you save on all prescriptions. If you do have insurance, you can still save.
So even if you have your own medical prescription plan, if there's a drug on that pharmaceutical plan that you take that is not covered, then you can use this to see if you can get either a better price or a better discount. So whether you're insured or not insured, it can be a benefit for you. And if it's not for your 2-legged family members, it might be something that your 4-legged family members might like.
Bartell's is one of the participating pharmacies, along with 375 others in the county. The program is administered by the National Association of Counties, or NACO. For more information, visit nacorx.org. You can register and download a card for free. You can also call 877-321-2652.
Has traffic ever made you late for a meeting at work? I'm sure we can all say yes to that. Well, now technology may make your next work conference a lot easier. Take a look at these smart collaboration rooms.
I can't deal with this traffic. Traffic is terrible.
Parking is really expensive.
Who would pay this much for parking? I can't find the right adapter for this laptop.
Oh, these files are taking so long to transfer.
It's a busy world. We have lots to do and not a lot of time to do it. But King County's new collaboration spaces make connecting easy.
We are putting up new smart boards so that video conferencing can be a lot more productive.
Here at King County, we have 30 new smart collaboration spaces, implementing 3 different types of technology.
And it's great technology.
As soon as you walk into the room, the Microsoft Hub will automatically turn on.
No fumbling with plugging in.
The more time you have for actually collaborating on work versus trying to get a meeting started, the more efficient you are and the better it is for everybody.
Need a map? No problem. Draw on the map? No problem. You can even send a photo from your phone to the screen.
You can use the digital whiteboard, use Skype to make calls, and have video conferencing.
Video conferencing brings the right people to the table to collaborate and get work done.
This is a good one.
This level of speed and collaboration means employees work smarter, cheaper, and faster. But the implications for King County residents are even bigger.
Using video and chat, displaying documents, having quick meetings, not having to get back in your car and drive back to work and losing a lot of productive time.
Both residents and King County employees agree that face-to-face conversations can make a difference. This system makes it possible.
It's not just interviews, it's also video hearings. All kinds of use cases now are starting to pop up because we have these capabilities. This is going to put us on par with what's going on in the private sector.
Best run government delivering best run technology for a busy, busy world.
Thanks for joining us for King County at your service. Please visit us online at kingcounty.gov/KCTV.